In this video, we are going to start with anatomical terminologies, and at the end of this lecture, students are expected to know the abduction, adduction, flexion, extension, and so many other things. So let's start. What is adduction and what is abduction? Abduction means moving towards the body. Abduction means moving towards the body. ADD, adduction. ADB. Have you heard of normal and abnormal? When somebody said you are abnormal, that person means you are not behaving normally. And when somebody said you are normal, means you are behaving normal. So let's use that word to understand this. Up, meaning you are moving away. Add, you are adding. Addition in mathematics, you are adding. Adduction means you are moving towards the body. Flexion and extension. Extension, you are increasing the angle. In extension, you're increasing the angle. In flexion, you are decreasing the angle. Now take a look at this. This extension and this is what? Flexion. We are decreasing the angle. How? I'll explain that later. Let's start with anatomical terminologies. So terms of movement. So we have flexion, to narrow or reduce the angle of the joint, as I've explained. Narrow or to reduce the angle of a joint. So when you are reducing the angle, you are actually flexing that part of the body. An extension, to increase the angle of a joint. So any movement that uses the increment of the angle of a joint, we said it is extension. Now let's talk about abduction. Abduction, to take away. Abnormally, you are behaving abnormal. So abduction, we are taking away. Movement away from the midline, from the mid-sagittal plane. So any movement that requires the movement of the upper limbs away from the mid-sagittal line or the midline, we said it is what? Abduction. So you remember, the mid-sagittal line is the line that crosses the body from the cephalic to the caudal part, or from the head to the tail part, and divide the body into two equal left and right parts. Now we have adduction, we are adding, we are moving towards the body. So whenever you're moving towards the body, or moving towards the midline or the mid-sagittal line, we say this is what? Abduction. We have pronation, rotating the forearm so that dorsum of the hand faces anteriorly. So I will explain this. I will use diagram to explain this better. You understand this better. So pronation and supination, they are similar. So in supination, rotating the forearm to the palm of the hand faces anteriorly. Don't worry, I'll show you diagram. Rotating the forearm so that the palm of the hand faces anteriorly. And during pronation, the radius or the ulna is crossing the head. The distal part of the radius is crossing over the distal part of the ulna. I'll show you diagram so you're going to understand all these things better. So we have circumduction. We are involving the four major movements, which is the flexion, the extension, abduction, and adduction. Also rotation, there are 5. So in subduction, we are doing flexion, extension, abduction, adduction, and what? Rotation.